Hi everybody. Hope you've had a good week. Since my last video, I have assessed some new clients for services, and with one this week, I initiated the Healthy Ideas. He signed the authorization so I could let his doctor know his score on the PHQ-9. So the follow-up visit next week will be setting some goals and discussing some activities that he may like to do. This is a gentleman who is taking care of his wife at home. I also set up respite for a man who is taking care of his mother, and he really desperately needs to attend the support group. He is working full-time, he works at nights, and he has somebody that comes during the day to see to mum, but he needs that break to meet with other people in the support group. In fact, he has been there once since I started my internship, but this respite that I set up for him this week will enable him to attend through to the end of our fiscal year, which is June. So that's been put in place. So he was relieved about that. I attended a caregivers conference, and I managed to acquire some ideas for tools that I can utilize and incorporate into my interactions with my clients, mainly on questions on self-care, but you could tell that the people who attended, probably about 40 caregivers, did get a lot out of that conference, and a lot of them asked questions about support groups. They'd never attended support groups, so I actually, although I was part of the audience, I did have something that I did contribute with regard to how support groups are really, really good things to be involved in. They really are. So I enjoyed that. I also attended the Behavioural Health Professional Association meeting last week. The association is mainly comprised of LPCs. There was a child psychologist, child psychiatrist, doctor, and some social workers. So it was a good chance to network with other people. I met them for the first time. There was another MSW intern there. So it was a very interesting mixture of people. There was a presentation on exposure therapy, which I didn't know anything about. I'd heard of, and that was about it. So that was interesting. And also I was introduced to something called the Lazarus Project, which was actually established in 2007 in one of the counties here in North Carolina. Since then, it has spread out into communities, nationwide, to include tribal communities as well. And it is a community coalition development which was put in place to prevent overdose of prescription meds and opioids. So the whole idea for the program is to promote substance abuse use treatment and provide support services, a bringing together of the community. And I think if you wanted to look something up, it's lazarusproject.org, provides the information. So something new that I learned about, and something I would certainly like to learn some more about. Next week, I am attending the National Alliance on Mental Illness Crisis Intervention Conference. There are lots of breakout sessions involved, and I'm in the process of, deciding on some of the sessions that I'm going to sign up for. I definitely signing up for improving interaction when working with dementia, people with dementia, of course, and I'm looking at possibly signing up for instance, is there a better way to teach crisis intervention treatment and de-escalation skills? I know a little about it. I would like to know more, but there is also another session on crisis negotiation, so I kind of torn between the two. Anyway, my question for the group this week is to ask you if any of you have had training in crisis intervention and what your thoughts are on the importance of learning these skills. And I hope you all have a good week. Hope to hear. Bye.